Hi, everyone. We're going to give it a minute or two for folks to join before we kick off. Thank you. I'm going to give a few housekeeping notes before we begin. Excuse me. If you have any insights or resources that you'd like to share, please put those in the chat. Chat is currently disabled. I will open it as soon as we start the presentation. Also, if you have questions, it's best that you use the Q&A function at the bottom of the screen. We'll try to follow in the chat if there's questions, but we cannot guarantee that we'll always see them. But if you put them in Q&A, we'll definitely try to get to them at the end of the presentation. For those who may not know, I'm Tanya Verkaitis, the Executive Director of PSRPA. I'd like to welcome everyone to the fourth and final day of the second annual Shifting Paradigms Conference. We've had the opportunity to hear from a great collection of community leaders, researchers, and organizations over the past few days, and hope that you found it educating and engaging. Today, we'll hear from Jamie Banks, the president and founder of Quiet Communities. Jamie is a healthcare and environmental scientist with an extensive background in health outcomes and economics, environmental behavior, and policy, who brings a multifaceted perspective to her work. During her career, she held senior consulting positions at ABT Associates, CRA International, and ML Strategies, the consulting arm of Mintz Levin, working with healthcare industry. In 2007, she turned her attention to environmental health and climate change, first founding Planet Rewards, a company pioneering a corporate platform to promote eco-friendly behaviors, and then founding Quiet Communities in 2013 to help find solutions to problems of harmful noise and pollution affecting communities. In addition to her role at Quiet Communities, she chairs the Noise and Health Committee at the American Health Association and is leading efforts to develop policy statements around noise and related pollution. The first APHA policy statement, Noise as a Public Health Hazard, was published in 2021. Jamie holds a PhD in social policy health economics from the University of Kent in the UK and earned her master's degrees from Dartmouth Medical School and MIT. With that, I'm going to pass it off to Jamie. Thank you.
Thanks very much, Tanya. Let me try and share my screen here. Okay. Well, I want to thank you again, Tanya, for inviting us and the chapter of PSR and giving us this opportunity to present on noise as a public health problem. We're trying very hard to raise awareness, to put noise back on the national agenda so that people pay attention to it and give it the serious consideration that it deserves. I'm going to start by introducing some colleagues that are here today with me, and that will be available to participate in the question and answer session. Arlene Bronzaft, PhD. Arlene is a professor emerita at City University of New York, has served various mayoral administrations in New York, and is widely considered one of today's leading experts on noise, children's learning, and health. Dr. Dan Fink, who heads our Quiet Coalition program, is a retired internist from Cedars-Sinai, has been working as an activist in different areas, most recently noise, and really focuses on restaurant noise, which is his pet peeve, and also noise-induced hearing loss. And then Sally Lusk, PhD nurse, researcher. Sally is Professor Emerita at University of Michigan, I think School of Nursing, and was the primary author of the American Academy of Nursing's position statement on environmental noise. So I'm happy to have them here with me today. I'm going to talk a bit about quiet communities, give you a sense of what we do. Our mission is to promote quiet as a valuable natural resource. We work to reduce harmful noise and related pollution. And our goal is to create quieter, more sustainable, and more livable communities. We work broadly in all different kinds of areas of noise, transportation, land care, construction, and everything you can see here listed on the slide. As scientists, we're really a coalition of scientists, physicians, and legal professionals. We take an evidence-based approach to looking at the problem, and we are solutions-driven. We don't want to talk about the problem. We want to find solutions that will work, be economically feasible, and help us to get to our goal. We started in 2013, and what you see here is what initially drew my attention to this problem. I heard loud noise hours a day, several days a week, coming from mostly leaf blowers, but a variety of other fossil fuel equipment. Saw workers out there without hearing protection or respiratory protection, and thought, this just can't be good. It can't be good for worker health. I knew it wasn't good for my health, and connected with a lot of people in the community where I lived, as well as across the country. In May of 2013, with the help of a community member in particular that was very upset about this problem, we started Quiet Communities to bring evidence-based resources to communities so they could present their problem cogently and based on facts. We started with 3 people. Today, I'm happy to say we're more than 40 people. And again, a coalition mainly of professionals, but we work with communities all over the country and are starting even to work internationally. It's our 10th anniversary this year, so it's a celebratory year for us. Our work really sits at the intersection of science, policy, and community. Today, we have 5 programs, but are working on others. I'll start on the left. You see the leaf icon there. That's our Quiet Land Care program. We have a program called Quiet American Skies, which focuses on reducing aviation noise and related pollution. Our Quiet Coalition program is responsible for the blogs that you see almost daily posted on our website. Quiet Healthcare works to reduce noise in hospitals and other healthcare facilities. And Quiet Empowerment is about giving marginalized communities the means to make their problems heard and to find solutions. More nascent programs that we're working on is a Quiet Streets program to look at issues of traffic noise, modified vehicle noise, and again, to find solutions. Let's see, we also have, what is this program, Trish? We have Quiet Streets. Well, anyway, I'm sorry if I forget. We're also starting a Youth for Quiet program. So we're growing and hopefully helping communities address noise. I want to start by talking about sound versus noise and thank my colleague Arlene Bronzaft, who talked about this recently in one of her podcasts. Sound is really the energy that's coming from a source, but noise is how people react to that sound. What is that human response? And if you think about it, you could hear sound that is the same decibel level. One might be a violin playing a concerto, another might be a lawnmower, but your reaction to that is going to be very different, presumably. And the lawnmower is what one would what one would perceive as noise because it's bothersome, it's unwanted. So noise as unwanted sound is the traditional definition developed by engineers and has stood as a definition for many years, but more recently with the work of Dr. Dan Fink, inspiration from Arlene Bronzeff's grandson, and the work of all of us at Quiet Communities, we proposed a new definition of noise, which is that noise is unwanted and or harmful sound. And this is really to bring attention to the fact that noise has serious health effects. In terms of sources of noise, there's many sources of noise around us. It can be equipment, vehicles, music venues, personal listening devices, and so forth. And in many cases, these sources of equipment are tied to fossil fuels, internal combustion engines that make noise. In terms of solutions, electrification is one that's been proposed and hopefully will be quieter. Electric cars, electric equipment, and so forth. Noise, environmental noise, has become the new secondhand smoke. This is because people are being involuntarily exposed to noise which can be harmful to their health, just like with cigarette smoke. When people think of noise, they think naturally of decibels because that's the common metric used to represent loudness. But noise is much more than decibels. It's that sound energy measured by decibels, but it's also the frequency. Is it something like a strong bass tone like a boombox, or is it something high-pitched like the squeak of chalk on a blackboard? What is the pattern of that noise? Is it something that is chronic? Is it episodic? What's the duration? How long is it lasting? What is the sharpness or tonality of that sound? All of these things go into how people respond to noise. It's not just decibels. If it were, the sound of a dripping faucet would never bother anybody. I want to give you one example. This comes from a study that we did a few years ago. What you see here is a circle, two circles that represent a densely populated neighborhood. What it shows is that a battery electric blower, leaf blower, rated at 65 decibels at 50 feet versus a gas leaf blower also rated at 65 decibels at 50 feet have very different impacts on these communities, as shown by the pink circles. So what we did here was we looked at how far sound over 55 decibels, that's a threshold that is considered a safe threshold, that under 55 decibels is considered safe, over 55 decibels is considered potentially harmful to health. So what you see here is that even with the same decibel rating, that electric blower is going to affect far fewer houses with noise over 55 decibels than the gas blower. And that is because the gas blower has a strong low frequency component. And that allows loud sound to carry over longer distances and also penetrate more readily through walls and windows. This has a big effect on how disturbing communities find noise and should be incorporated in any measure of community impact of noise. The health impacts of noise are various. We normally think of our ears as being affected by noise. We know that loud noise can cause hearing damage, but what is less intuitive is that noise also can have non-auditory effects. We'll start with the auditory impacts. Loud sound, persistent sound, chronic sound, the excessive sound that we hear in everyday life can cause noise-induced hearing loss, tinnitus, hyperacusis, and then there's also sequelae that fall from noise-induced hearing loss that include higher risk of falls, depression, social isolation, and dementia. We know that when there's hearing damage, work productivity can be diminished or quality of life diminishes, and there are increased healthcare and societal costs associated with it. The way noise damages the ear is that it vibrates the eardrum and the bones in the ear, which vibrate the hair cells. When noise is loud enough or you're exposed to noise over enough time, you can have permanent damage to those hair cells, causing hearing loss that's irreversible. And you can see in the upper right here that the noise that causes this type of hearing loss is not usually just one loud sound, but it's decades worth of all the things we hear in our everyday life that may be emitted at levels that are harmful. There's a number of non-auditory impacts of noise: cardiovascular disease, metabolic disturbances that can increase risk of obesity and diabetes, increased risk of anxiety and depression. There's a suspected link to Alzheimer's and dementia. There's impairment of children's learning, work productivity, again, reduced quality of life, and all of these are associated with higher healthcare and societal costs. So I'm going to talk about these non-auditory impacts because they're not really intuitive. How does something that you hear actually affect your heart and other organs? What happens is that our body reacts by being annoyed, being angry that we're having our activities disrupted, other emotional responses, and these set off a stress response in the body. That's the first line response. In turn, what our body does is it releases stress hormones like cortisol and neurotransmitters. And those in turn can increase cardiac output, blood pressure, blood fats, blood sugar, other indicators that are risk factors for conditions like hypertension, coronary artery disease, heart failure, and so forth. What's been shown by research is that nighttime noise is especially dangerous. And this may be because the difference between ambient noise at night, noise levels are lower, and environmental noise, the difference is greater. And so we can wake up, have our sleep disturbed, and this in turn sets off reactions in our body that are harmful to health. As I said, noise impairs children's learning. Arlene Bronzaft is here with us today, has a lot of experience, did some of the pioneering work in this field, showing that noise impairs children's learning. This is something we've known now for 40 years. There was an extensive study done by the National Academies of Science, Engineering, and Medicine that showed that students near airports exposed to noise greater than the 55 decibel threshold have lower test scores, but that effect doesn't happen when children are either moved or somehow protected with sound insulation. The Federal Aviation Administration admits that this is a problem. It's invested hundreds of millions of dollars to insulate schools and protect children's learning. There are certain groups that are particularly vulnerable to the effects of noise: children and adolescents whose organ systems are developing and are more sensitive to damage, veterans who might suffer from post-traumatic stress, seniors, some of whom have pre-existing conditions or hearing disorders, and then other people who may have neurological conditions that make them more sensitive to noise. These include people on the autism spectrum who have sensory processing disorders, hearing disorders, and attention deficit. The impacts of noise are considerable. It's unfortunate that in the United States, and for reasons that I'll explain, we haven't had a lot of money over the past 40 years to do research. And so the full costs of hearing damage, of non-auditory damage in the United States has not been calculated. What we do know from what's available is that the costs are considerable and range in the billions and billions of dollars every year. We have 15 to 62 million American adults who have noise-induced hearing loss, 6 million children between the ages of 12 and 19 years who now have noise-induced hearing loss, mainly from unsafe listening practices related to personal listening devices, loud music venues, and so forth. 146 million Americans are estimated to be at risk for hypertension or high blood pressure due to noise exposure. And again, what you see here are those dollar amounts, $3.9 billion per year saved annually just by reducing noise-related hypertension and heart disease. It does not account for the many other conditions that can result from noise. And then hundreds of billions of dollars a year estimated to be lost from work production losses and remedial education needs due to diminished learning. Noise is also an environmental justice problem. Poorer communities tend to be located closer to industrial areas, to airports, to other transportation hubs, to highways, and experience louder noise. There's been several national studies now that have shown this, as well as a number of local studies. What happens is that because of this increased exposure, these communities can have poorer health outcomes, as well as more learning problems when schools are located near these sources. Noise is often referred to as simply an annoyance or a nuisance. We hear this over and over again, but the problem is much more serious. The CDC recognizes this, Center for Disease Control and Prevention. The World Health Organization recognizes this too. This is because we now have 40 years or more of extensive research demonstrating these health effects. Okay, so what I'd like to do now is talk about policy in the US and how we've come to be living in a world that's very noisy today with little that we can do about it. In 1968, noise was first declared a health hazard by US Surgeon General William Stewart. He declared noise is indeed a public health hazard, a matter of public health concern. Aside from hearing loss, it's been demonstrated that noise from aircraft and other sources causes physiological changes, including cardiovascular, glandular, and respiratory effects, reflective of a generalized stress reaction. So everything you've heard today was known 40 years ago. Soon after, in 1970, Congress enacted the Clean Air Act. The Clean Air Act identified noise as a pollutant and required it to be studied, and required that there would be an Office of Noise Abatement and Control established. In 1972, with the enactment of the Noise Control Act, that office was established within the newly formed EPA. A sister legislation, the Quiet Communities Act, was enacted in 1978, extending the ability of EPA to provide technical assistance to states and localities. Unfortunately, after operating for 10 or more years, the Office of Noise Control and Abatement was defunded, and work on noise essentially came to a halt. We still have the promise of the Noise Control Act. It's the policy of the United States to promote an environment for all Americans free from noise that jeopardizes their health or welfare. But with that defunding, this piece of legislation, even though it's still on the books, is not being implemented or enforced and has not been for 40 years. So in 2024, we basically have no effective federal noise control program today to protect the health of the public. So what does it mean to have no federal program? It means we don't have the means to educate people sponsored by the government. There's not funding for research. We don't have product labeling programs. We cannot enforce existing regulations that were developed in the 1970s when that office was active. We don't have the ability to create new regulations for products that generate excessive noise and are sold nationally. We don't have a quiet product program. There's no funding for assistance to states and localities, and the EPA has no way to keep up with the science that has been rapidly progressing, showing that noise affects human health and, by the way, also affects environmental health. At Quiet Communities, we hear from communities every day that have noise problems and really don't know where to turn. They don't know if they have any recourse at all. These communities are being affected by aircraft noise. Some of them are having hundreds of flights going over their homes at low altitude every single day. Some of them have walls cracking or roofs peeling. They can't get away from noise that goes on day and night. We hear from communities that have gravel pit operations, mining operations near their communities, again, affected by noise, rumbling noise, et cetera, that comes right into their homes. Computer server farms, a more recent source of noise, is affecting communities and farms. A lot of these are located in rural areas. Noisy restaurants and entertainment venues can be harming people that work within those facilities, patrons of those facilities, and in some cases affecting neighborhoods that exist around those facilities. Industrial noise, land care noise, construction noise, modified road vehicle transportation noise, railroads, and even situations like in hospitals, noisy hospitals where that noise can affect patient abilities to recover and lead to greater medical errors. Some resources to look at. There are policy and position statements that have been developed by the American Academy of Nursing. As I mentioned, Sally Lusk, who I think is here with us today, was primary author of that statement, published in 2016 and a follow-on publication in 2017. The American Public Health Association, my committee there on noise and health, produced a policy statement that was adopted by the organization in 2021. It's well worth reading. You can find it easily if you say noise, a public health hazard, and combine that with American Public Health Association, it should pop right up. More recently, the American Academy of Pediatrics put out a position statement on noise and children's health. And then there are our guidelines from the World Health Organization, 2018 guidelines on transportation noise and leisure noise, community noise guidelines published in 1999 and then updated in 2009. And then we have guidelines from the Environmental Protection Agency, but those guidelines are now, 30, 40 or 50 years old. And seriously need to be updated. The Hearing Health Foundation has a Keep Listening campaign. They are very concerned with the unsafe listening practices, especially for children today, but also for adults. This is something that they have on their website, and you can find by going to their homepage. So I just want to give some sense of what we at Quiet Communities are doing. We like to bring stakeholders together to find common ground and to find solutions. We raise awareness through our blogs, which are produced almost on a daily basis. Dan Fink, Arlene Bronzaft, and others contribute to this. It covers all kinds of topics. As we mentioned, a new definition of noise that Dan really pushed was recently adopted by the International Commission on the Biological Effects of Noise this summer and is bringing attention to the health effects. With regard to the Noise Control Act, we've been working with the University of Washington Law School for many years now. We actually decided, after a number of steps, starting with a petition, discussions with EPA, we decided that we had no choice but to bring suit to get the EPA to follow the law and implement and enforce the Noise Control Act as required. That's ongoing. We're in litigation. In land care, we're helping institutions, municipalities, businesses, etc., transition to low noise, zero emissions land care. These are practices that can cut noise by half or more. In aviation, we're doing a lot of education, briefings, videos to make people aware of the dangers posed by aviation noise in aviation impacted communities, and to try and get short-term as well as longer-term technology solutions implemented and accelerated. We're also working with environmental justice communities who are beleaguered by noise and may not have a voice or know how to organize and get together to address sources of noise. And then we try and work with media to spread the word. This article here was published in June of this year. It's a wonderful article. It sounds alarming. Noise can take years off your life. Here's how. But when you read through it, you can really understand those insidious impacts that noise can have when you are in a noise impacted situation or community. Oops. Don't know if you could hear that, but the slide had a recording that I did for another presentation, but I think you saw it. It was a statement by the former US Surgeon General that noise must be considered a hazard to the health of people everywhere and taken seriously. I'll end now and just say, as a nonprofit organization, we depend on our members and donors to support our work. And if any of you are interested, we would like to encourage you to join us. And we thank all of you for coming and to the chapter of the Physicians for Social Responsibility in Pennsylvania. Thank you very much, and we're happy to take questions.
Thank you, Jamie. I will go through the questions here. I didn't know if you might want to keep that contact slide up for a bit, though, because there were a lot of questions about how to get in touch with you all. So maybe leave that up there for folks who may need that information.
Oh, sure. No, happy
Also,
to.
I just wanted to let you know that Arlene is here should you want to pass any questions to her, and should the others join, I'll let you know. But to kick it off, we have a question from Vicky. She's looking for information on how to guide her town maintenance department on the transition to battery-operated leaf blowers and address their concerns about how to charge, length of operation after charging.
Well, thank you for the question. It's a very particular one, and we know that a lot of people that contact us are interested in cleaner and quieter land care. We have some programs that would be of interest. One that may be of immediate interest is an online course for land care professionals to educate them in all the basics they need to know to transition to battery electric equipment. And your maintenance department is correct in that it's more than just switching out a tool. There are concerns about setting up safe and proper infrastructure, charging these safely, operating them so that you can get a certain level of work production as comparable to gas as possible, and so forth. So there are, things that are needed to make a successful transition. And please contact me and we can talk about this more, and I can let you know more what's available.
There's another question about leaf blowers, so I'm just going to throw this in now. This is from Ellen. She says she's had 5 to 6 concussive episodes from her neighbors' landscapers using very loud gasoline-powered leaf blowers. It's caused nausea, sleep disturbances, tinnitus, super sensitive hearing, etc. She wants to know if you can help them create a strong law in Massachusetts to ban gas-powered leaf blowers, but also is wondering how they can offer financial incentives to get a fund going for landscapers to switch. Do you have any thoughts about that?
I have a lot of thoughts, and we're doing a lot of work in this area. I'll tell you, Ellen, it's complicated. The push to get regulations has been going on for years. The unfortunate thing is that it brings industry into conflict with neighborhoods. And often when you get regulations, they can be effective, but they need to be enforced. And that's been a problem in many of the towns and cities that have enacted regulations, spending years to get them enacted, only to have them in place and then not have them enforced. So it's a big problem, and there needs to be subsidies for landscapers to be able to afford the higher upfront cost of the equipment, the battery bank they need to get through each workday, and then account for the loss in work productivity, because the equipment tends to be less productive than the gas equipment. And we know that the business model today is going from house to house to house and having that volume of customers as their revenue base. And when you have equipment that doesn't get you there, it's a potential loss of revenues. At the same time, communities are really suffering from the noise, and I'm very sorry to hear about the problems that you're having. I totally understand. This is what got me into quiet communities to begin with. But again, I'm happy to speak with you further, and feel free to email me and we can be in touch.
We have a question from Laura, wondering if there's any best practices for limiting emergency vehicle siren noise.
So this, I'm going to ask Arlene if she knows about. I don't know much about it.
Can you hear me?
Yes.
Yes?
Yes.
Yes. In European cities, they use emergencies vehicles as we do, but they have different types of sounds that are less offensive. In New York City, there is actually a group that has been formed to advocate for less noise intrusive emergency sounds, and yet they have not yet been that successful, but they are advocating for it. They have joined together, so if anyone wishes to contact me, I can put them in touch with individuals who have studied this problem and recognize, like other sounds that we could also moderate, as Jamie well knows, that we can employ sounds that will still effectively get these vehicles to the emergency situations, but be less offensive as far as the community members. So anyone get in touch with me, I will follow through and get them more information. May I add one thing? May I?
Yes.
Somebody asked a question about the noise in schools, and it's not just enough to lessen it. We should really, to insulate, we should do something to lessen. May I address that one?
Yeah, Arlene, please go ahead. And any other comments that you have, feel free to add.
The person said, with respect to school, it's not enough to insulate. We should go to the source. Well, if you looked at my study, in which I found the train noise adversely impacted on children exposed to the elevated train tracks. Their classrooms were next to the tracks, and the trains were coming by every 4.5 minutes. The study did demonstrate by the 6th grade that children were nearly a year behind in learning. But when I started that study, I was asked to help the children. Merely publishing a paper was not sufficient. And so, supported by parents, media, and community leaders, I went to the Transit Authority, learned that they had a new procedure to quiet tracks, persuaded them to use that procedure, and they persuaded them to use the procedure next to the school as the first pilot study as to whether it can indeed lessen the noise. They did agree. People say, how did you get the Transit Authority of New York to agree? I call it a miracle, but they did use the quieter technique adjacent to the school. I also got the Board of Ed to put acoustical ceilings in the classroom, so that was important too. But after the 2 abatements were in place, the classrooms were considerably quieter, and I was asked to do a second study. And we found that the children now, in a quieter classroom, even though adjacent to the tracks, were reading at the same level as children on the quieter side. So I hope that answered the question, because we went to the source to try to abate the noise. And when they did do that, the children's reading improved. May I add that then the Transit Authority agreed to use that procedure along the entire system, because people not only go to jobs that are near the tracks, children go to schools near the tracks, they live with that noise day and night. And the Transit Authority agreed. So I want to say that we can indeed go to a source and lessen the noise. And as Jamie said, my study was done over 45 years ago. The procedure to lessen the noise that led to improved learning, that paper was published over 40 years ago. So we know what to do. We just lack the will to do it. Thank you.
Thank you. We have a number of questions here, so I would like to get to as many as possible. We do have until 1:30, just so folks know. We'll do our best to answer them. And I'm just going to jump around a little. So a question here, Jamie, is given Quiet Communities' national initiative to hold federal government accountable to existing legislation, how can we follow suit at the state level?
That's a really good question. I suppose, and maybe Arlene can chime in on this too. Do you have an answer, Arlene?
Yes, New York State
Okay.
has introduced legislation regarding modifying your mufflers of your vehicles. So when they go across the road and people in the neighborhood are exposed to them, they are loud and disturbing. And we have at the state level passed legislation that demands that people who modify their mufflers will be, receive violations. And those establishments that do the modifying are also held accountable. So I do believe you should check New York State legislative material that deals with modifying mufflers, and that is now not permitted. It still has to be enforced. That's the problem. Excuse me.
Yeah, I would just add also, there really our congressional representatives need to hear, whether they're at the state level or the federal level, need to hear from the public about all these problems. And I think as people are becoming aware, they're starting to talk to their local officials and as well as their state and congressional representatives, but I would urge you all with these problems to be in touch and to tell them about the problems that are occurring. Because it really needs to be addressed at many levels.
Thank you for saying that, Jamie. That's actually something that we say at PSRPA quite a bit. We are definitely here as a resource and to serve the communities that we're engaged with. But if community members aren't participating in the process as well, it isn't going to go very far. So thanks for amplifying that message. A question from Stephanie. Thank you so much, Dr. Banks, for a great presentation. Something I've struggled with in explaining with others is how does noise affect those with hearing loss? I understand hearing loss is not all or none, but do you and others know if there are effects of noise on those with hearing loss? Could those who have sensory loss still experience effects of noise in terms of noise intensity?
So I'm not an expert in this, but people that have hearing loss or hearing damage can be, they're really one of the groups that are very vulnerable to the effects of noise. What I'd like to do is suggest that you reach out to Dan Fink, Dr. Dan Fink. You can see his email here. He's very responsive. This is really his area of expertise, and I'm sure that he can be helpful to you.
Dr. Fink is here if he'd like to add anything to this question. You can unmute.
Hi there. I guess you can't see me, but I hope you can hear me over the gas-powered leaf blower that our neighbor's gardener is illegally using here in our small city here in the Los Angeles area. If you Google my name and disability rights, you'll find my paper from 2017 in Proceedings and Meetings in Acoustics. Ambient noise is a major disability rights problem for anyone with auditory disorders, which includes basically half of everyone over age 65 and pretty much anyone over age 80. It has major impacts on loneliness, because if you can't understand what someone's saying in a noisy restaurant, you start declining invitations, and that just increases loneliness. United States, 30% of people over age 65 live alone, and a meal with a friend or a family member may be the only time, other than talking with a salesperson, if they're bold enough in the COVID era to venture out to a real store instead of ordering everything online, maybe the only time they ever converse face to face with another human being. So noise is a major disability rights issue. So I want to mention that. I apologize for joining late. I was on a quarterly conference call with the Centers for Disease Control, where I serve as a subject matter expert on noise and the public. And looking at the chats, somebody said something about how do we get our unaffected Congress members to quit treating the noise issue as a problem of a bunch of whiners? I've been working on that with my colleagues at Quiet Communities Incorporated on promulgating a new definition of noise, which I developed in conjunction with them. That's been published. The new standard definition of noise is unwanted sound. And as Doreen commented, that implies that any of us complaining about noise, there's something wrong with us, puts the onus on us. We are weak, we are neurotic, we are chronic complainers, we are radical environmentalists. What the new definition of noise, acknowledging noise is harmful, and that actually came from Arlene Bronzaf's grandson, who I think was 14 at the time. Noise is harmful sound, and it has auditory and non-auditory health effects. And so cite the new definition in your communications with your elected representatives. The new definition was adopted by the International Commission on Biologic Effects of Noise for international use last year at its 14th Congress, which Jamie also attended. I'll stop there.
Yeah, I can just add to what Dan said. And Dan, thank you for that. I was able to talk about some of that in my presentation. So the resources, the American Public Health Association position statement, the American Academy of Nursing position statement, the American Academy of Pediatrics, different resources from World Health Organization. These are things that you can find and that will state very clearly that there are serious health effects of noise. This is not just about annoyance. It's not just about complaining. It affects our bodies in serious ways.
Thank you,
May
Doc.
I add something to what Dan
Yes,
just said that we haven't yet discussed? While my study looked at the impacts of noise on children's learning, I also questioned them about their reactions to the noise. We can't leave out that the children were bothered by the noise, that they felt uncomfortable with the noise. And in fact, when the press came down to interview the children from the schools, they expressed that very well. So I don't want people to think that children's learning was just impaired. Children psychologically were being affected by it. And as Dan said, that my grandson of 14 was able to speak to it. The reason he can is because he gets awakened by planes at 20 to 6 in the morning where he lived. And so he could express very well on a podcast when he was interviewed how he felt about the noise. So I don't want to leave out that children psychologically, whether at school or at home, are being disturbed by sounds that are affecting them. I'm not going to elaborate further on it. My grandson is now 18, and I think one of the pluses of being away at school is he's not hearing to those planes that are awakening him each morning. Thank you.
The other thing is that people have to appreciate how extensive the science on noise is. There is 40 years worth of research. There's 2,200 or more peer-reviewed scientific publications on the health effects of noise. The fact that World Health Organization now has guidelines defining safe levels, this is all based on an extensive review and synthesis of scientific literature to set those levels. These organizations do not just step up and arbitrarily say things that is not grounded in a lot of scientific research. So that should give you some confidence in saying that we know the harms of noise. And actually today, we know them down to the cellular and molecular level. We know exactly how noise affects the body.
we actually have a question about airports. So since we're on that topic, I'm going to throw that out there. This comes from Heather. She lives on the Colorado Front Range, where regional airport activity has increased 40% plus over the past few years. The airport's noise roundtable is fueled by politics and completely ineffective. The airport director was recently fired for calling community members who complain nut jobs. In short, the airport hides behind the FAA, and the FAA tells the airport to work with communities. It's a roundabout of a lack of accountability. Legislators are largely hands-off, lest they be perceived as anti-business. Any suggestions on how to push through such a logjam?
Lena, let you take a first stab.
Who?
You want to take a first stab at that?
Did you say me?
Yeah.
I hear. Yes, I have been working on aircraft noise with communities across the country. I've also conducted research on the effects of aircraft noise on people's health and well-being. And while my subjects in the study, residents living near airports, had not yet evidenced serious adverse health effects, they did lose sleep and their quality of life was diminished. Let me explain that people who live with aircraft noises, my daughter and her family, they can't use their backyards. Their planes are flying overhead. COVID gave them a respite from this, and they were able to hear birds and enjoy their outdoors. Their life is being diminished. So here's what you have to do. I know I attend the roundtable in the New York area. I too am frustrated because I don't see anything coming out of it. I refer to the FAA as Friends of Airlines and Airports. The one positive, I know that's the name, Friends of Airlines and Airports. The one positive that I can speak to is that the FAA spent $400 million to abate noise at schools near airports. And my study did lead the list of studies that resulted in that money. But you know what they did when they spent the money? They admitted that they're harming our children. It was an admission. And I would urge communities throughout the country to take that admission because, as I said, they didn't just harm the children's learning. They were harming their mental and physical health as well. Go with that, stress that, and get your Congress people to realize how damaging the aircraft noise is. The one positive thing is that we have so many groups that really care about this. But when I speak to them, they're still so frustrated. We need some action from Buttigieg. We need some action from Biden. And although Reagan may have closed the Office of Noise Abatement, it was the following presidents that still kept it closed. So I do urge you to pressure Congress people. There is a committee in Congress now, led by Grace Meng, that's aiming to refund the Office of Noise Abatement. But your voices have to be heard. I have to say this loud and clear, that the FAA knows that noise is not just annoying, because that's what they keep saying. If it was just annoying, they wouldn't have spent $400 million to quiet the schools. So it's just a matter of joining groups and becoming activists. And if any group, and Colorado, I have a real positive feeling towards. My daughter graduated from the University of Colorado, and I visited there quite a bit. I will work with any group on trying to get the message across to the Friends of Aviation and Airlines. Thank you.
I'll just add something. We have an 18-minute narrated video on aircraft noise and emissions. That's like a primer. It also talks about policy. It talks about the FAA and brings up, how difficult it's been to make change, have changes made there, or have receptivity to community problems with noise, both commercial aviation and general aviation. What I can do is share this with Tanya, and maybe she can send out a link so that people can watch it.
Jamie, can I chime in for a minute?
Sure, Dan, go ahead.
I will be speaking on March 5 at the UC Davis Aviation Noise and Emissions Symposium in Palm Springs. And the title of my presentation is "The FAA Allows Americans to be Exposed to Unsafe Levels of Aviation Noise." My second slide is basically 3 lines. The FAA says a day-night level of 65 dBA A-weighted decibels is compatible with residential land use. Second line, the Environmental Protection Agency has determined that a DNL day-night level of 45 decibels for indoor noise and 55 decibels for outdoor noise are safe noise levels. Anything above that is unsafe. Third line, therefore, the FAA allows Americans to be exposed to unsafe levels of aviation noise. End of story.
Sure.
the manuscript for that topic is under review. I hope it will be published soon. I will Jamie will be aware of it, and I'm sure she will share it with Tanya and PSR in Pennsylvania. My strategy, my advocacy strategy, and I will share this with the group. I don't write letters to my elected representatives. I don't demonstrate in public or go to public meetings. I word things in finely crafted emails to regulators in positions of responsibility who, if that science-based, evidence-based email became public knowledge through a Freedom of Information Act request, they'd be permanently embarrassed. It's like, how come you're allowing the American public to be exposed to unsafe levels of aviation noise? And here's the evidence. And so I share that strategy with you, and hopefully the publication will be available soon.
Yeah, there's also going to be a special issue coming out of the Journal of Exposure Science and Environmental Epidemiology. There'll be some of the papers in that special issue will be published, and then they're going to all be aggregated into a special hard copy issue, but that'll have some very, very interesting articles on the health effects of noise, the economics associated, and what can be done about it.
Thank you. And thank you, Dr. Fink, for sharing your strategy. I think that's a great one. We do often try to back everything that we say with science and research because it can't be refuted in that case. I have a question here from Chris. It states, do you work on a municipal level for sound ordinance updates? It seems the fossil fuel industry takes advantage of communities without sound ordinances by working hours which families are at home. Example, allowance to work all night long, or hammer drilling during COVID lockdown while people are working from home and homeschooling children. Are there good examples of municipal ordinances that we could use as a template?
May I?
Yeah,
Please.
Arlene, go ahead.
Yeah, New York City, I know many people think of as a loud place. And yes, there are loud sounds in New York City. There are also some good ones when the ball falls on Times Square New Year's Eve, or when children are shouting at the passing characters during the Thanksgiving parade. But New York also has had noise ordinances dating back to the early 1930s. The most recent one was updated in 2007. And I do urge people to go to New York City Department of Environmental Protection and look at the New York City Noise Code. It's quite good, but as far as I'm concerned, it needs updating. The City Council of New York has attempted to update it by introducing bills that modify certain sections of the code. They've also tried to update the way it's enforced by using noise cameras to identify the license plates of those cars that are zooming by very loud. That's a pilot study. Today, I am asking the City Council, as I did in 2005, to update the noise code. We know much more, as Dan has illustrated, in terms of how loud sounds can be before they harm us. We also can measure sound with apps, so we don't have to rely on the FAA to tell us how loud a plane is that is passing overhead. We can put a sensor on a window and we can identify the time the plane flew over and how loud it is. So I am now trying to work with public officials in New York City to update the code. But I would still suggest that people look at the GP noise code in effect because it's helpful. I'm also working with people in Toronto that are attempting to update their noise code. And I'd be willing to work with citizens in any city that already has a code and would like to see it updated and because we have much more knowledge now. But the key thing, whatever the code is, it needs enforcement. And that's what I hear from people all over. Codes are often not enforced. So we need updating, but we also must have enforcement. So do look at our code, and I think it's covered many areas. And we have been, passing bylaws in New York for nearly 100 years. Thank you.
I'd just like to throw in a question really quickly, because you did just talk about putting sensors on the windows, and we did have someone ask about meters or helpful ways to document noise. Do you have recommendations for resources or tools that people can use to document noise in their home?
Well, let me give you one tool that is being used called Soundprint. It was an app that was designed to measure how loud restaurants are. And people want to go to a restaurant, eat the good food, but they want to converse. And so now we have an app that does that, but it also, the site for Soundprint also identifies quieter restaurants as well as louder ones. The quieter ones you may wish to attend, and the louder ones avoid. The sensors on windows have become part of a study, and a study was conducted by a professor at NYU, and he collected data on how loud the planes were that came over their homes by having the sensors on windows. So I don't know that these sensors could be, put on and by ordinary individuals, but there are groups that are working together on studies in which they will be using sensors to identify aircraft noise. As far as your home, there are now apps. Well, I'm now wearing an Apple Watch. If you turn to noise on your Apple Watch, it'll tell you how loud the sounds are in your room now. They should have used the word sound, but I think they use the word noise because they want people to be more aware that sounds can be harmful. So just a watch on your hand will tell you how loud the room is, and you could then work to try to make it quieter. I don't know if that helped in the answer that you were looking for.
Thank you. I believe that was helpful.
Okay, my watch.
I'm actually going to go back to the gas-powered leaf blowers for a second, because we have two kind of related things. First, Ed Wren, who is with Wild Ones Native Plants, talks about transitioning from non-functional turf grass to native-based landscapes. We can certainly put some information about that in the chat. But alongside with that, Alice asked, have there been any studies considering the combination and compounded effect of both noise and particulate matter? And that's part of why I mentioned the natural landscapes, because I think you would escape some of the particulate matter. Both are big problems and emit large amounts of pollutants into hyperlocal air environments. Do you know of any studies like that have been?
I've conducted a study on that. I conducted a study of air pollution and noise from overhead aircraft on individuals, so that if you check the literature, and I worked with a person who is specialist in air pollution, because I'm not, but if I can get back to you, I'll get you the citation exactly, and it looked at the effect of air pollution and noise on people's health. With that, that's a start that I can give you, and there are other studies.
There are definitely studies out there, and I think the number of studies is going to keep increasing, because the real emphasis is on looking at, I think they call it the exposome, multiple exposures and how synergistic they are. and how all of those exposures are affecting our health. So, yeah, so whatever's out there now could be helpful, but I would keep an eye on the literature as well, because I expect there to be more studies going into the future.
From Yvonne, we have a question about false noise reduction solutions that get pushed by industry. How to correct these misconceptions, and can you talk a little bit about their efficacy?
Sorry, can you say the question again, Tanya?
Yes, she asked if you could talk about false noise reduction solutions that get pushed by industry.
Arlene or Dan, do you want to take that one?
Let me hear it again. It's how
False, like not real noise solutions being pushed by industry, things that are being commercialized, but they don't really work. They're making claims that, don't
Okay.
prove out
May
in
I-
real world settings.
Okay, may I use one example from the FAA that you know about, Jamie, that I raised the question about 2 days ago? The FAA is trying to give the impression that they are working to lessen noise in our community. And so one of the things they are doing is they're educating the airlines to become more aware of noise, hoping that they will employ techniques that will lessen the noise. And they will be awarding airlines, in this one report that we heard from the aviation industry, that they will be awarding airlines that will attempt to quiet the communities. However, the one question I ask, will they actually be quieting the communities? So the impression is that by educating airlines to how painful noise is for communities, that they will then follow through, and they will be getting certificates that they've attended courses educating them. But the thing that I asked, and Jamie is aware of this, is there any evidence that this education will lead to actual reduction? It gives you the impression that they care about the situation. Caring is not enough. Doing is what leads to noise reduction. So that's just one example that I learned about, and Jamie did as well 2 days ago. So you can follow on that, Jamie.
You're muted.
Sorry about that. Yeah, no, I think Arlene's right, and that's a good example. You really have to demonstrate or validate that whatever they're proposing is going to have an outcome, and to be able to demonstrate that it produces that outcome. And that's something that you can say, where is the validation that this works? Other than that, I don't really have much to add about it. I think healthy skepticism, though, of anything pushed by industry is probably the way to go.
Yeah, Jamie, Dan Fink here. Let me chime in. That's not an area of the noise world that I follow, but in general, I would agree with Jamie. Trust but verify, as I think Reagan said. And the beauty of modern technology is that almost everyone has a smartphone. The NIOSH sound meter app has been shown in research to be the most accurate of the bunch. It's available for free. Just the Google NIOSH sound meter app and download it to your phone. And then you can take measurements, and you can complain to your elected representatives and to the enforcement people in whatever municipality or state you live in that you are still recording, and you can download the recordings to your computer and email them directly. You're downloading you're still recording sound levels of whatever it is at whatever time from whatever source. The city of Santa Monica, California, going back to leaf blowers, as somebody mentioned, bans actually all leaf blowers, because even the battery-powered leaf blowers aerosolize dog waste, tire waste, spores, molds, whatever. But enforcement is very simple. Anyone can file a complaint with, I forget the exact name in Santa Monica, the Code Enforcement Bureau. You just take a picture of somebody using the leaf blower, you write the location, and then you email it to the website, and they take action against the owner of the property. And community-based data gathering for scientific studies and community-based enforcement of noise ordinances is something that's already being done. So if your elected representative says, oh, we can't do that, it's like, well, excuse me, sir or ma'am, but they're already doing it. So don't say it, or it can't be done. Don't say it can't be done. If you want to say you don't want to do it, that's a different thing, but it can be done. I'll stop there.
Thank you. There's been a number of references to fireworks,
Mhm.
ordinances around that. Do you have any recommendations or resources to share?
I could share. Yes, do you hear me? I don't know.
Yes.
Yes.
Yes. New York City, we have complaints about fireworks. I've been working with a group in northern Manhattan on that. Our New York City noise code, if you check, does say that illegal fireworks are not permitted. It definitely is in our code. However, again, let me stress, enforcement is key. And so the people that complain about it are saying that we don't necessarily enforce it. And so there have been complaints, but I would urge people to look at the bylaws of a city and see if that is included. At least the bylaw should state it. And then you should advocate for enforcement, because that seems to be the key problem across the country in cities that do have bylaws. There's lack of enforcement, but it definitely could be stated in a city bylaw. I hope that helps.
Dan Fink here, let me chime in. Fireworks noise is a pet rights or animal safety issue. It is a issue for people on the autism spectrum, and as well as for people with post-traumatic stress disorder, which includes millions of combat veterans all across the country. In Europe, in certain cities, they have banned noisy fireworks, and they have silent fireworks where one can enjoy the display but not hear the sound. And technology, again, in many communities, they've now switched to drone light displays, maybe with a band playing patriotic music on July 4th or something like that. But it's far different from fireworks. Here in the LA area, on New Year's Eve, people set off illegal fireworks. It sounds like World War III, and if I were a combat veteran, I'd be under the bed or in the cellar.
Thank you. We have a question from Nalini. Have there been any noise hearings in Congress in recent years? Is that a far-fetched goal for us to pursue?
No hearings.
Lean, do you know of any?
No, I don't know of hearings. The only thing I do know of Congress people who've met together, because there is a group that now Grace Meng heads in Congress. So there are groups of Congress people that met. And prior to Grace Meng, when Nita Lowey was in Congress, she also had a group of Congress people that she met with to discuss it. But I don't believe they ever led to formal hearings. So the best we have had are Congress people concerned about the issue, introducing legislation to refund ONAC, but I don't know, and I'll check with Jamie or Dan. I don't know of any formal hearings at the congressional level other than the conversations amongst Congress people who would like the legislation to be introduced and passed.
Yeah, no, that's my understanding too. And that, that said, we've had some interest expressed by some of the congressional staffers in terms of, hearing about aviation noise. We did a presentation, a briefing for staffers a couple of years ago. We've also tried to bring this to the attention of the White House Environmental Justice Advisory Council, the National Environmental Justice Advisory Council. The EPA has created one of the things that they're doing is created a screening tool so that they can assess the risk of various environmental stressors on environmental justice communities. And we have tried very hard to bring noise into that conversation, and it's basically been ignored. But, part of the problem is, okay, we don't have federal legislation. We've had noise referred to as an annoyance or a nuisance for years. People think it's trivial. Level of awareness is just not where it needs to be. And so this is, we're trying to do this, but we're trying to take on, what the federal government should be doing in a lot of cases, and it's just not there. Hopefully that'll change in the future.
We have about 10 minutes left, so I'm going to do 2 more questions before we close. Julia asks if there are philanthropies that support local activism against adverse health effects of noise.
It's, similar to what I just said, because noise has been off the radar screen. We've looked for grant money and are continuing to do so. And it is starting to come up through some of the grant opportunities that are now available. But in general, noise has just not been one of the areas of solicitation for foundations. In terms of local activism, I know that there are some grassroots foundations. I'm thinking grassroots environmental. I'm forgetting what the exact name is. There are environmental justice organizations that have some small grants to issues. So, but I can't give you a definitive answer, unfortunately.
This question comes from someone living in College Station, Texas, where they're a test site for Amazon's drone delivery program. They say it's very noisy and disruptive inside and outside of the home. Are there other communities fighting this expansion? And do you have suggestions?
Well, I'll just start out and say there's the traditional aviation sectors, which each have their own problems. With commercial jets, it's the Next Gen program that's concentrated flight paths over a smaller number of communities. These are communities experiencing hundreds of flights a day. There's problems with general aviation traffic, low-flying planes. There's even harassment in some cases of communities that complain. And then there's, of course, these emergent sectors, whether it's the electric vehicle devices that are going to be air taxis or drones and so forth. We don't know of any, at this point, any organized community activity. We're certainly starting to pay attention to it. I would say that there's a perception that anything electric is going to be quieter, but that we know that that's just not true. There is a requirement for any of these drones to have, there's a regulatory requirement to file a report. I think that those are publicly available, and maybe, you can find them and use some of that in your in your argument, putting it together to look at levels of noise. But at this point, I can't offer too much more than that.
Thank you. I'd like to thank you, Jamie, for your presentation and sharing the work that Quiet Communities does. Also, Arlene and Dan, thank you for sharing your expertise in this area and supporting the Q&A portion of this presentation. I also want to thank all of the attendees who have been here today and other days this week, where we focused on organizational and individual roles in preserving the health of frontline and frontline communities while fighting climate change and the industries that harm them. We heard from experts who shared actionable strategies for activism and empowerment, research on health impacts in proximity to toxic infrastructure, and reports on the fossil fuel industry. We hope that these webinars have inspired you to take action for the change you want to see in your communities and beyond, and are here for you as a resource as you do the hard work of being a change maker. Please continue to move and inspire, and have a good weekend. Thank you, everyone.
Thank you, everybody.